For some people, weight loss is necessary for medical reasons, but some may have a hard time losing the weight and need to turn to surgical options. We're here at Adventist Health Castle to find out who might be a good candidate for bariatric surgery.
Bariatric surgery is a drastic intervention to improve someone's health through an operation. And it does this by basically making changes in how the body processes sugars, proteins, and fats through cellular and organ signaling. Typically, my operation is going to be bypassing a portion of the intestines or changing the shape of the stomach. And what we're doing is we're changing the gut signaling mechanism. Only 10 to 20% of people will actually gain their weight back, but the main focus is looking at the health benefits related to the operation, not necessarily the weight loss. We want to kind of reserve this big intervention for somebody who is really looking for a significant health benefit. It's going to be somebody who's met with their healthcare provider and they've been told they need to do something. These people are smart enough that they know that the next big diet fad out there is pretty much a waste of their time. They're looking for something that's going to be substantial to improve their health, that's medically proven. These are the types of individuals that might be a candidate for it. 80% of people with a diagnosis of diabetes will see improvement in their medication, taking less medication. 60% of people with a diagnosis of diabetes will actually have their disease go into complete remission. 80% of people will get off their obstructive sleep apnea breathing machine at night. So these numbers are probably the most substantial and best numbers you're going to find within any type of medical intervention out there today. These operations are done in conjunction with a comprehensive program. You need the dietary component, the behavioral component, pre and post-op nursing care, the exercise component. So all of these are integral into a good, safe bariatric operation with an expected good outcome. All these operations are done laparoscopically. They typically are about 1 to 3 hours in the operating room. Someone spends one night in the hospital, they're home the next day. We're showing a death rate of less than 1 out of 1,000, a complication rate less than 5%. These procedures are actually extremely safe. Our program here at Castle Adventist Health, we've been doing it over 10 years. We've got a long track record and experience where we can kind of give you the facts of the good and the bad related to these operations. The best thing you can do is start talking to your doctor. It could be your primary care doctor, your subspecialist. Ask them if this operation is going to make a significant change or how it's going to change the care of them.
This segment is sponsored by Adventist Health Castle.